Hi again, this is Dr. John, and I'm going to answer a question that we get asked all the time, and that is, why do we do functional medicine? Let me go back a little bit, and I'll tell you that the reason I chose traditional Chinese medicine is I felt that it gave the best overall picture of you as a person and your patterns and the ability to personalize to you of any form of medicine that I could find. Also, the treatments are very, very gentle and very, very powerful. We generally don't have to resort to drugs, although a lot of my patients come in and they're on multiple prescriptions, and that's fine, and we work with that. And so with Chinese medicine, we want the biggest picture possible. It's the macro of everything. It's like the doctor's looking through a microscope, we turn it around and make it a telescope. We want to get the biggest picture possible. Then why functional medicine? Well, functional medicine is a branch of biomedicine, Western medicine, practiced largely by medical doctors, but also some acupuncturists, chiropractors, psychiatrists, etc. That the earliest quote I can find is from 1870, 1870, where a Dr. Wade was giving a lecture in London, and he talked about the problems with the medical system and the fact that it wasn't personalized to the patients. And he said he practiced functional medicine. And that's the first I can find reference to that term. However, in 1991, Jeffrey Bland instigated with several brilliant doctors the Functional Medicine Institute, again in 1991, and they looked at thousands of cases, looked at labs to see not just what killed people in the short term, but looked at what was the best range of all these labs for prevention. So, for example, in patients, particularly in menopausal women, triglyceride levels, which are floating blood fats, are far more predictive of health problems, in my opinion, than cholesterol levels. If I send a patient to LabCorp, for example, who I like a lot, they'll say they want a level of triglycerides under 150. Well, with functional medicine and with my view of this, I really want people under 100. Because once you get over 100, you see that there are some changes in insulin receptivity and a variety of other issues. So, if there are labs that I have gotten from other medical groups that say triglycerides are normal up to 839. So that's 8 times what I consider normal, right? That's a big difference. And 5 times what LabCorp considers normal. Now, the difference in your health between having triglycerides at 100 versus 800, it's so dramatic you wouldn't believe it if I gave you the numbers. So we look at functional medical values. For example, women that are in the normal, quote, normal range of white blood cell count, if they're in the top quartile of that range, they die at about twice the rate of other women over the next 10 years from heart attacks. Once again, I don't consider that normal. That's something that we want to prevent. Now multiply that out through all of the blood tests, the Chem 14, that's 14 tests. We're going to look at your urinalysis. We're going to look at a complete blood count, which is astonishingly underused by the medical community, and I could go into hundreds of issues there, which I actually do in my classes. So that's functional medicine. It's looking at labs differently. It's looking at the ranges to make you healthy, or actually at levels that even if you're in the quote norm, you could still be unhealthy, and that can point us to the right direction. For example, I don't treat a lot of pediatric patients anymore, but I used to treat quite a few. Of all the kids that came to me with a diagnosis of ADHD, exactly 2 of them ended up needing to go on pharmaceuticals. And I thought they did. I mean, I thought that was a good thing to do. 80% of those patients, 80% avoided using the drugs for ADHD by increasing their iron levels. There are studies going back in France decades ago showing that kids with ADHD tend to have phenomenally low ferritin levels. Ferritin is a storage marker for iron. And once we got their iron levels up, the kids were fine. So that's the importance of functional medicine. And when you combine it with traditional Chinese medicine, you're getting the macro and the micro to create one giant pattern. So in functional medicine, around 2006, there was a definition that it's personalized, preventive, predictive, and participatory. And that's critical. Now we add the fifth P, which is patterns. Chinese medicine is all about patterns. We don't want to treat one lab value or two lab values. We want to treat you who are our patient, and these are just guideposts for it. But when you put it together, you get the most complete picture possible. That's why we do functional medicine with Chinese medicine. Thank you.